In this video, we will be covering the carpal tunnel syndrome. We will go over what carpal tunnel syndrome is, how it may present, what the surgical procedure entails to get rid of the syndrome, recovering and rehabilitation after receiving the surgery, as well as some surgical improvements that has occurred over the past few years. The carpal tunnel is a narrow passageway that is located on the palm side of the wrist. It is formed by the carpal bones and the flexor retinaculum. Structures passing through the carpal tunnel includes the median nerve, which innervates the thumb, index, and middle finger, as well as 9 flexor tendons. There are 4 from the flexor digitorum superficialis, 4 from the flexor digitorum profundus, and 1 from the flexor pollicis longus. Carpal tunnel syndrome is a common condition that causes pain, numbness, and tingling in the arm and hand. Carpal tunnel syndrome occurs when the median nerve gets compressed when passing through the carpal tunnel. Activities of the wrist joint influences the form and size of the carpal tunnel. The width of the carpal tunnel decreases with normal wrist motion as the carpal bones move relative to each other. The pathophysiology of carpal tunnel syndrome includes a combination of mechanical trauma, increased pressure, and ischemic compression of the median nerve. Demyelination of the nerve develops in the area of compression and spreads to the intermodal segments where the axons are still intact. Continuous compression of the median nerve, blood flow to the endoneurial capillary system is interrupted, and this leads to the alteration in the blood-nerve barrier. The diagnosis of carpal tunnel syndrome requires a careful case history of the characteristics of carpal tunnel syndrome. This includes questioning the frequency of the occurrence of the symptoms that the patient may present with. Orthopedic tests for carpal tunnel syndrome includes Tunnell's sign and Fallon's maneuver. Tunnell's sign is positive when tapping over the carpal tunnel with a reflex hammer, producing symptoms of the median nerve distribution. Fallon's maneuver is when a patient flexes the wrist to 90 degrees and is positive when the flexing produces pain along the distribution of the median nerve. Symptoms that carpal tunnel syndrome may present with includes numbness and tingling primarily in the thumb, index, and middle fingers, which often wakes the patient up at night. Occasional shock-like sensation in the thumb, index, and middle fingers. Pain and tingling that travel up the forearm towards the shoulder. Weakness in the hand that can result in dropping objects. However, the pain is not always present.
A surgical innovation in the treatment of carpal tunnel syndrome that has gained widespread acceptance in South Africa within the medical community in recent times is called the Wallen technique, which stands for wide awake local anesthesia, no tourniquet. Traditionally, carpal tunnel release surgery is performed using regional or general anesthesia, along with the use of a pneumatic tourniquet to create a bloodless field. This method has several drawbacks, including the symptoms caused by the tourniquet, such as discomfort, the risk of anesthetic complications, and increased recovery time. The Wallen technique addresses all these issues. The Wallen technique achieves this by using a local anesthetic solution, typically 1% lidocaine combined with epinephrine, injected into the surgical site. The epinephrine provides vasoconstriction, is not effective, and knowing what surgical available enables us. In conclusion, also reflects the need for interprofessional collaboration between everyone within the medical profession.
Post-surgery, patients are generally able to return home the same day, eliminating the need for an overnight hospital stay. It's important to keep the surgical site clean and dry, adhering to the wound care instructions provided. Most patients find that over-the-counter pain relievers manage post-operative discomfort effectively. The rehabilitation process is structured over several weeks to ensure optimal recovery. Weeks 1 to 2 engage in gentle range of motion exercises to prevent stiffness and promote flexibility. Weeks 3 to 4, as healing progresses, gradually incorporate strengthening exercises to restore function. Weeks 5 to 6, most patients can resume normal activities, though it's advisable to avoid heavy lifting during this period. One of the key benefits of Volant is the immediate feedback it offers. Patients can actively participate in their rehabilitation by providing real-time input during their surgery. This approach not only leads to reduced recovery times, but also enhances overall patient satisfaction. Many patients report feeling more relaxed and comfortable throughout the surgical process. Long-term outcomes after Volant carpal tunnel release are generally excellent. Most patients experience lasting relief from numbness, tingling, and pain. Grip strength and hand function typically return within 6 to 12 months, although full recovery can take up to a year. Night symptoms like waking up with numb hands often improve quickly, though some occasional numbness may persist. Recovery varies depending on how severe the nerve damage was before surgery and whether the patient has other health conditions like diabetes.
Improvement of wide-awake local anesthesia not tonic. In 1950s, there was a false belief that adding adrenaline to anesthetic solution and injecting it to the digit caused necrosis. But that was until 1990s when surgeons started to use lignocaine because of its low toxicity. Lignocaine, when combined with adrenaline, can be safely injected up to 7 mg per kg. Due to the establishment of the safety of wide-awake local anesthesia not tonic, minor procedures can be performed in office rooms, and only 6 patients have been reported to develop superficial infection. In developing countries like South Africa, where public hospitals often have shortage of staff, limited resources, and also limited theater access, the wide-awake local anesthesia not tonic is the best solution in these settings because of its safety, effectiveness to be done in office rooms, thus reducing cost and increasing access to healthcare. During COVID-19 pandemic, the wide-awake local anesthesia not tonic, it helps to reduce the hospital strain by avoiding general anesthesia and incubation, allowing for a quicker and safer procedure, short hospital stay, and a higher number of patients satisfied